With respect to the health care debate, we are having a vigorous debate in the United States, and I think that's a healthy thing. The reason it's necessary is because we are on a currently unsustainable path. We spend far more per person on health care than any nation on earth. Our outcomes in terms of various measures of well-being don't rank us at the top. We're not doing better than a lot of other advanced developed countries that are spending much less per person. Individual families are being bankrupted because of the lack of insurance. We've got 47 million people without health insurance in our country. For those who do have health insurance, they are always at risk of private insurers eliminating their insurance because of a pre-existing condition, or because of they lose a job, or they have changed jobs. So the final aspect of it is that our health care inflation is going up so rapidly that our federal budget simply can't sustain it, nor can businesses that are increasingly having to make decisions whether they hire more workers or eliminate health care, whether they stop providing coverage or they force more costs onto their workers. So the whole system's not working well. Now, how do we change it? When it's 1/6 of the U.S. economy, there are going to be a lot of opinions. And Congress has moved forward, and we are closer to achieving a serious health reform package than we have been in the last 40 to 50 years. But there's going to continue to be a vigorous debate. I've said that the Canadian model works for Canada. It would not work for the United States, in part simply because we've evolved differently. We have an employer-based system and a private-based healthcare system that stands side by side with Medicare and Medicaid and our Veterans Administration healthcare system. And so we've got to develop a uniquely American approach to this problem. This, by the way, is a problem that all countries are going to have to deal with at some level, because if medical inflation continues at the pace that it's going, everybody's budget is going to be put under severe strain. And so what we're trying to do is make sure that we've got a sensible plan that provides coverage for everybody, that continues the role of the private marketplace, but provides people who don't have health insurance or have fallen through the cracks in the private marketplace a realistic and meaningful option. And we've got to do it in a way that also changes our delivery system so that we're not engaged in the kind of wasteful, inefficient medical spending that is so costly to us. So I suspect that we're going to have continued vigorous debate. I suspect that you Canadians will continue to get dragged in by those who oppose reform, even though I've said nothing about Canadian health care reform. I don't find Canadians particularly scary, but I guess some of the opponents of reform think that they make a good boogeyman. I think that's a mistake. And I suspect that once we get into the fall and people look at the actual legislation that's being proposed, that more sensible and reasoned arguments will emerge, and we're going to get this passed. Sorry to take so long on the question.